Authorities say the man behind Wednesday's deadly shooting at Fort Hood in Texas was seeking treatment for mental health problems, and as we reported earlier in the newscast, that included treatment for depression and anxiety. The evaluation that this particular soldier was a part of also was looking at potential for post-traumatic stress disorder. And joining us for more on that is Dr. John Kupfner, a psychiatrist with Peninsula Outpatient Centers. And thanks for being here. We appreciate it.
Thank you for having me.
Let's talk a little bit about PTSD and what it is.
Okay, so PTSD is when you've been exposed to either yourself or you've seen something that's sort of life-threatening, limb-threatening, horrifically traumatic. So you either have an intense fear reaction, and these memories are written down in the part of your brain that records fear. That's the longest form of memory. Or a lot of times you can just become a zombie, like depersonalize, and have what we call shock. So you can't tell from which way somebody's reacted to this life-changing, scary event, which they're going to end up with PTSD one way or another.
And by that definition, it doesn't only impact veterans.
Absolutely not. I had a patient just today who I diagnosed PTSD who was in after a major car wreck on the interstate.
You have treated a number of veterans in your work, though, and what have you seen with that treatment as far as numbers-wise? Are we seeing more veterans from the more recent wars in Iraq and Afghanistan seek treatment for this than compared to wars like Vietnam and World War II?
I think after Vietnam, this became a little more, they used to call it being shell-shocked. That was the old term. It became a little destigmatized within the veteran community. You didn't have to hide it from everybody, so people would start to seek treatment. And then, of course, when we went into the Gulf Wars, then we saw more and more people come out and be comfortable reporting veterans that they were struggling with this and seeking treatment. The VA was very open to inviting in and screening for people that were having problems. So
we also have been reporting today about a group saying that often veterans feel comfortable seeking help from a pastor first, and then perhaps that pastor can lead them to people like you who specialize in this treatment. What's your assessment of that?
Well, it depends on how much it's affecting your functioning. If you are not sleeping at night, if you're having nightmares, if you're doing a lot of avoiding of situations because you're afraid of having flashbacks from this traumatic event and it's interfering with your life, you need to get serious mental health treatment right away.
Any other specifics about PTSD that you can offer that might be helpful to an audience that's hearing a lot about this right now?
Well, I think people are confused by this illness and whether it's real or not real or what it really means. You got to understand the brain lays down memories in a couple of different places. The memory part that's laid down in what we call the amygdala structure in the brain is emotional memory. So this is where this trauma takes place. Emotional memory can stick with you for a lifetime. Your earliest memories in childhood are probably emotional ones. Why, in many cases, having this is like having a chronic illness like diabetes that you are going to live with and deal with forever in one way or another.
If people need help, what's the best way to get it?
If people need help, they should talk to their primary care doctor who can get them a referral to see somebody, either a counselor or a psychiatrist, depending on whatever the level of need would be. Those are the gatekeepers that are going to help them get to somebody they need to start treatment.
Dr. John Kupfner, thanks for your perspective. We appreciate it from Peninsula.